glad that you've tuned in for this episode. Well, it is the start of the new year, 2018, and we've had some great episodes that are focused on your New Year's resolutions to include exercise as well as nutrition. And it's been a wonderful journey to learn about exercise and nutrition. And today we have a special episode, and that's going to focus on body fat. Something that we all need to be mindful of, and maybe for others, they are at an optimum body fat content percentage, and for others, they may need to work on their body fat. And there's so many reasons why it's important to work on the body fat. But let me share with you the most important reason is we want you to have a life of wellness. We don't want you to have reasons that could have been preventable that could be a precursor for a fatality. There are so many conditions such as high blood pressure and heart disease, respiratory dysfunction, diabetes, and so many others that we'll discuss a little bit later in this episode that can be a precursor for death. And unfortunately, in many cases, it's due to the body fat content we may be holding on to within our bodies. So today, without further ado, I want to share with you about body fat and belly fat because they can be tied in together, and want to equip you with some great strategies on, number one, knowing what your body fat is, knowing what body fat is, and where you need to be concerned about your life as well as any family members or friends' lives. Our body's consistency is water. As you know, we have a lot of water within our body. Typically about 70% is about the average, a little bit less, a little bit more, just depends on the body. And then minerals, of course, we are composed of minerals. We're composed of protein. Last but not least, what our discussion is about today is fat. We are composed of fat. And now, granted, we have two types of fat. We have fat that is essential. That means that within the major organs of our body, we have fat within them. And it's so important to have that for essential functioning of our body. So the liver, the heart, the pancreas, the stomach, the brain, they all have some form or level of fat, essential fat. And again, our body needs to function efficiently on that essential fat. Again, our body needs to function on that essential fat. Now, the essential fat is good and very important for us, but where the other form of fat is detrimental to our health, and that is stored fat. So stored fat is what can cause other medical conditions, as we mentioned before, to begin in our lives. And as time progresses, if we continue to store fat and more fat and more fat beyond what our body, our set weight or set body fat complexity should be composed of, then that can be a precursor to lots of medical conditions that can, over time period, advance and cause unfortunate circumstances to medical conditions, diseases, as well as fatalities. So that stored fat, you have fat that is adipose tissue, and that's the concern, is the adipose tissue, which is beneath our skin. Now, we're also going to talk about visceral fat, which is beneath that area, so beyond those layers, the fat, the muscles, and beyond those layers, especially in behind our stomach, the visceral fat is there to protect, so to speak, our organs. But if visceral fat becomes too much or out of control based on what our set body fat is designated to be, then it could be the danger zone. It is actually called a double danger because it causes, of course, other medical conditions, but yet it also causes the body to function inefficiently, as well as causing it to pull on certain areas and hormones and secrete lots of other things that we really should not have excess of throughout our body. So women typically have more fat than men, and relatively speaking, because there are some women that are smaller than some men, and some men that are smaller or larger than some women. So one of the reasons why women generally have a little extra fat is to bear children and nourish children. Now, women tend to have the pear-shaped bodies. That's where the hips and the bottom are a little bit larger and the stomach tends to be a little bit smaller. So the shape of the body is like a pear. So it starts a little bit round at the hips and the bottom, and then it levels out and thins in a little bit. Men have an apple shape, and that's with time. Men have an apple shape because as they gain more fat, typically it goes right to the belly. So we need to be mindful of that. Now, it's better to have a pear shape than an apple shape. And the main reason why is belly fat has been known by various studies to cause a lot of other medical conditions, diseases, and again, fatalities. So let's talk about women. The question for you today is, should you change your shape? Well, I think it's important to know your body composition, your body fat percentage. And that's for both men and men. They should know their body fat percentage, and that's very important. We usually say if you're noticing your abdominal area to be bigger, or you're maintaining that or moving towards that apple-shaped body, then that's a concern. It is leading to obesity, as well as I mentioned, so many other conditions that could be detrimental to your health. So it's important to measure that area as well. And how you can measure, you want to take a tape measure, place that around right above your belly button and below your rib cage. That general area, around that area, and measure that. When you're measuring the body fat using a tape measure, you want to take the tape measure and actually go around your body. You want to go right above your belly button but below your rib cage. So feel around that area. You want to hold the tape measure pretty snug, and you don't want it to turn. So you want to make sure everything is level. One side is not higher than the other side, but it goes directly around that area. If you need assistance, certainly ask a family member or friend. Once you get to that level, you're going to exhale. Try not to breathe in because you want your true measurement. And you're going to hold and find out what your actual waistline is. If you are greater than 35 inches for women, that shows that you are in the obesity range, and that opens up to increased belly fat and also concerns of various different medical conditions. For men, if that area measurement is 40 inches or greater, then the same is you're in that obesity area or range, and it can leave you susceptible for various medical conditions. So please be mindful of that, and that is a concern. So your body fat can be affected by various factors. Number one, age. As we get older, we actually tend to hold on to a little bit more fat, okay? One of the main reasons is our metabolism slows down. We may not be as active performing cardiovascular exercise as well as weight training to build up that muscle, that our metabolism tends to slow down as we age. So that can be a factor that interferes with our body fat percentage or increases our body fat percentage. The second factor would be your genes. Now, I say this lightly because, yes, if hereditarily you are disposed to have an apple shape as opposed to a pear shape, then that's going to be there. However, I'm a firm believer that you can fight it. You can fight it. You might have to work extra hard, but you can fight it with exercise, of course, nutrition, and really being intentional on that. Thirdly, the next factor that affects body fat and belly fat is gender. As I mentioned before, women tend to hold on to a little bit more fat because of the childbearing experience that they have, number one. And number two is the nutrition that our bodies naturally hold on to fat in preparation for that as well as after that. Now, as we get older, like to the menopausal years, whether it's in the 40s leading on after that, then we have less estrogen. So with that lower amount of estrogen, the hormone, that also can cause an increase in body fat. So keep that in mind. So when you do get older, you may have to ramp up that exercise program a little bit so that you can maintain a good, normal, set body fat for your body composition. Now, men, on the other hand, they don't have as much body fat accumulation until they get up to maybe 40s on up. And it's scientifically proven that at 50 years old or after, for men especially, is that you should be consuming 200 fewer calories than you did when you were in your 30s. So that's really important as well. Now, we talked on the last or the fourth factor that increases belly fat, and that's hormones. As our hormones fluctuate and change, that can have an effect on our bodies in increasing belly fat as well. And to maintain a proper body fat composition. And to do that, it requires being intentional with having healthy nutrition as well as exercise. The increase in belly fat makes it more than difficult to zip up those pair of jeans that you always looked great in. Research has shown that, again, it can cause a lot of medical conditions. And to name a few, we talked about heart disease, diabetes. Those two are overwhelming our country with lots of different experiences and medical conditions. It can cause respiratory conditions, breathing difficulty. It can cause inflammation in the body, which can cause a change and lead to autoimmune disorders. It can lead to arthritis. It can lead to dementia, and it can lead to so many other medical conditions. So it's so important to make sure that you are not building up excessive body fat throughout the your entire body, but most importantly, you're not accumulating excessive belly fat. In the belly or tummy area is what I call it. So there is an opportunity for you to make a change if you are accumulating more in that area. Your weight is largely determined by the balance of your food intake and how much energy you actually expend. Now, we in America, we love to enjoy food. And the food that we enjoy is not the best type of food. The fast food, eating out plentifully, food that's high in fat, food that's high in sugar, beverages that are high in sugar, such as soft drinks and juices that are high in sugar. Those various things can really make an impact on our body. And so we want to be focused on making sure that the amount of food we consume is just sufficient for what we need on a day-to-day basis, number one. And number two, that we are adequately expending that energy that we consume. Now, if you're not burning those calories, then that fat, unfortunately, gets stored subcutaneously right underneath the skin, as well as in the visceral area. Then that fat in the visceral area will overtake our organs and cause them to function inefficiently and appropriately. So when they function inefficiently, then they need help to function. So they start to secrete other hormones and various other things that can be harmful to our bodies when it's in excess. When you have excessive belly fat, it can cause high blood pressure, high cholesterol that's abnormal for our body, particularly the lipids are getting higher. It can cause diabetes, type 2 diabetes that's found in adults that stems from factors such as improper nutrition intake as well as not enough exercise and activity. It can cause problems such as dementia with increased fat surrounding the brain and throughout the body, the visceral area. It can definitely lead to dementia. It can cause arthritis throughout that body. As you know, there's so many people that do have arthritis, and they may wonder, why do I have arthritis? Now, of course, as time progresses, our bodies do degenerate. Various structures within our bodies do degenerate. However, they can be propelled at a faster rate in degeneration when our bodies have inflammation surrounding it from having too much belly fat. The average person should try to attain at least 150 minutes of moderate cardiovascular exercise per week. That can include walking briskly, riding a bike, swimming. Those are great forms of exercise. Now, if you are a runner or jogger, then they recommend at least 75 minutes per week of running. They also recommend to perform weightlifting at least 2 days a week. That's going to help build up those muscles and make you stronger. Because, as we said, as you get older, our muscle mass has a tendency to decrease. So if we can actually continue a lifelong journey of strengthening our muscles, doing weight training, then our muscle mass will not decrease at that same rate. And then also nutrition. With nutrition, we are encouraged to focus on a plant-based nutrition plan. And what that includes is focusing on fruits and non-starchy vegetables. So various types of fruits are great for us, for everyone. And then non-starchy vegetables, so just to keep it broad, pretty much all vegetables are great, but try to limit the non-starchy vegetables, which typically include any type of potato, any type of pea, and some squash, various types of squash. But try to consume as much fruit and vegetables as you can throughout the day because it is healthy for you. It helps to decrease those cravings that we may have, those sweet cravings. And it also encourages a more healthier body fat composition as well as diminishes body fat. Also, lean protein. Lean protein is very important. Greek yogurt, cottage cheese, fish, and some lean protein like chicken breasts are great. So that's really important to consume. They have great vitamins and minerals that are essential for our body to function properly. Remember those essential fats, they may include those, but also not accumulate as much fat in our midsection area. It's very important to have those non-saturated fats as well. Great nuts like walnuts and almonds and olive oil, things like that are very important for us to consume to maintain our health as well. And then, of course, whole grains are very important. It's very important because they're good for us and they help us also eliminate waste. So staying to a plant-based diet is always recommended. And then you want to have portion control. To do that, it requires being intentional with having healthy nutrition as well as exercise. And we're going to talk about that a little bit later because I'm going to show you some great exercise techniques to do, particularly for the abdominal area. So welcome to my exercise domain, and what I'm going to do is share with you some exercises that can help your abdominal area, specifically help to reduce that belly fat that you may have, number one, and then also they're great exercises to do for preventative reasons, to prevent you from getting that belly fat area, along with doing other exercises and good nutrition, and it will be beneficial for you. So I'm going to share with you 5 exercises. If you are pregnant, you've had a recent surgery, or have had any medical conditions, I highly recommend that you speak to your primary care or your specialist to ensure that these exercises are safe for you to perform. So the first exercise I will share is a plank. I love the plank because it's an exercise that helps to trim down the belly fat, but you don't feel too uncomfortable while you're performing the exercise. So a plank requires you to get on your forearms and on your stomach. You're going to tuck in your tummy, lift your body up, and hold it. I usually recommend to hold for about a good 30-second count, and repeat 3 times is good to start. Now, as time progresses, the ways that you can increase the intensity or the involvement of the muscles and make them more challenging is to hold it for 45 seconds, hold it for 60 seconds, etc., so that you can challenge your muscles. The next exercise I'm going to share with you is actually performing a stomach crunch. Now with stomach crunches, you want to be very careful. You don't want to injure your back, so you want to try to keep your pelvis or tummy down. So what I usually tell people is to do a pelvic tilt, push your back flat onto the floor, and you can either put your hands in the small of your neck, or you can put them across your chest area, or you could reach out however you feel comfortable. Now, if you are going to do the crunch, I do recommend that you pick a spot on the wall and you try to keep your neck almost in neutral position as best as you can. And without curling your neck, just come up, hold for a few seconds, and then back down. Up, hold for a few seconds, and then back down. Again, my back is flat. I'm engaging my abdominal muscles by tightening my stomach, and I'm lifting up using my abdominal muscles. So that is a basic crunch, abdominal crunch. It is not healthy to do sit-ups because that can be dangerous for the low back. So I highly recommend the crunch. This third exercise I'm going to recommend is incorporating your legs. That incorporates the lower abdominals. So you're going to bring your legs up and you're going to crunch together and back down. Keep the back flat, crunch, and back up. So you're just lifting your shoulders and your buttocks area to crunch together. That is really good to incorporate the entire rectus abdominis, which is the muscles right in front of the tummy, as well as the transverse abdominis, which is another muscle on a little bit to the side. The fourth exercise that I'd recommend is to do some external and internal oblique exercises. And what that is you're going to bring your legs up and you're going to alternate side to side, side to side. Again, you're going to engage your abdominal muscles and go side to side. Now, when you're doing the crunches, start out with what you can do, and then as time progresses, increase your repetitions. Last but not least, the next exercise is actually for the obliques. So I like to lay on the side, and I'm lifting my head, my arm, and my leg, so it crunches this area here, and back down. Of course, you're going to do the other side as well. So right now, I'm focused on strengthening the right side of my obliques, and then I would simply turn around and I would simply strengthen the left side of my obliques by going up. So what I'm actually doing is a side bend here with my torso and my hip, and then I'm bringing the leg up a little bit to engage the front aspect of my abdominals. So those are 5 exercises that are going to benefit your abdominal area. Again, you have the plank, and that's holding it for a certain amount of seconds, 30 seconds, and increasing it to 1 to 2 minutes in time. Then you have the abdominal crunch with you're just moving the torso. And then you have the abdominal crunch where you're incorporating the legs. That's number 3. Then you have 4. I call it the bicycle. That is a great one. And then number 5, you have the side crunch exercise. Those are great, 5 great exercises that you can perform anywhere, at home, at the gym. If your job has a small gym there too, you can perform those exercises there. So it's important for you to focus on abdominal exercises. I also recommend to focus around that area. So strengthening your back muscles, strengthening the muscles surrounding your hips are very important too. We always want to keep our bodies in balance. So strengthening the front of our bodies, all the major muscles in the front, all the major muscles in the back as well is very important. So thank you for joining the Wellness Show today. I trust that it has been beneficial to you. And again, if you are on par and don't have much belly fat at all, and your body composition, your body fat percentage is perfect and intact within the normal ranges, and your body is functioning at that set weight and that set metabolism that it's required to be, and then share this information with a family member, a friend. It's important to share with other people what you know, the benefits that you take within your own practice, so that you can live a life of wellness and a loved one can also live a life of wellness. So thank you for joining the Wellness Show. As always, we want you, encourage you, and empower you to be well and live a life of wellness.